Good evening, and welcome to CRNA Today, where we deep dive into the stories shaping our nation's health. I'm Evelyn, one of your investigative reporters for tonight. Today, we're bringing you a critical report on health outcomes among some of the nation's most vulnerable populations. Together, we'll explore the challenges they face, the dangers of inaction, and the groups working to create change. To start, here's Kate Jones with a closer look at the background and barriers these communities encounter.
This morning, it was brought to our attention that vulnerable and underserved consumers are facing significant barriers in obtaining health coverage and accessing essential healthcare services. The complexities arise from a mix of socioeconomic, cultural, and systemic factors that make it increasingly difficult for these groups. Many individuals within these populations are at heightened risk for various health problems, often worsened by pre-existing conditions and a lack of preventative care. Limited financial stability, educational opportunities, and housing options are compounding these challenges. Trust issues towards government programs can further discourage individuals from seeking assistance, especially when sensitive personal information is involved. Additionally, those with limited English proficiency or cognitive impairments may struggle to provide informed consent, complicating their ability to access care. Key barriers include a lack of coverage, with many being uninsured or underinsured, and the high healthcare costs that prevent necessary treatments. Fragmented healthcare systems lead to inconsistent sources of care, while low health literacy can hinder informed decision-making. Transportation issues are particularly problematic in rural areas where access to care is already limited. Lastly, provider availability remains a significant challenge in medically underserved regions, where the number of healthcare providers is often insufficient. The diverse population of vulnerable consumers encompass racial and ethnic minorities, refugees, immigrants, young adults, new moms, individuals with disabilities, and Medicaid-eligible consumers who may stay unenrolled due to a lack of awareness. And addressing these disparities requires targeted strategies at both policy and community levels to ensure that all consumers can achieve optimal health outcomes and contribute to a more equitable healthcare system. And now, Evelyn from Utah has a new development on the issue. I'll pass it along to Evelyn.
Thank you, Kate, for laying out the background. Now, let's address the urgency behind the issue and what we stand to lose if we don't take immediate action. For millions of vulnerable Americans, limited healthcare access means that preventable illnesses aren't just an inconvenience, they're life-threatening. Imagine battling a chronic condition like diabetes or asthma with no reliable access to regular checkups, much less specialized treatment. A lack of intervention isn't just about discomfort for these individuals. It can mean a dramatically shortened lifespan. Without change, we can expect a continued rise in preventable hospitalizations and even premature deaths, straining not only families, but our entire healthcare system. When communities lack healthcare resources, it affects everyone. We see it in overcrowded emergency rooms and in families forced to make impossible choices between basic needs like food, housing, or medicine. This gap also takes an economic toll, driving up healthcare costs and leaving taxpayers to bear the brunt of preventable crises. Experts warn that the longer we ignore this reality, the heavier these costs will become. And let's not forget the future. If we don't act now, younger generations will inherit a system that fails the most in need, perpetuating cycles of inequity and hardship. We risk creating a country where the health outcomes are increasingly tied to income and zip codes, rather than to basic human rights. Our healthcare system should be a source of strength and not hurdle. Addressing these issues now could mean the difference between these communities surviving and communities thriving. Grace will now dive into the organizations that are taking on this challenge head-on and pushing for meaningful change. Grace, over to you.
Thank you, Kate and Evelyn. My name is Grace, reporting to you live from Montana. It has been well established throughout this segment that health disparities within vulnerable populations is not just a local issue, it is a national crisis. The question remains, though, what is being done to help improve health outcomes within these populations? We have established a brief list of organizations that are working at both a national and international level to bridge gaps in care. The first and most well-known organization is the Center for Medicare and Medicaid Services. This governmental agency has a priority of improving health equity with a robust health equity framework. They have established the Coverage to Care initiative, which helps link people to both primary and preventative services. The Center for Medicare and Medicaid Services has also established the Office of Minority Health, which is aimed at eliminating health disparities and improving health across all minority populations, including members of racial and ethnic minority groups, members of the LGBTQ+ community, persons with disabilities, persons living in rural communities, and those with limited English proficiency. The Center for Medicare and Medicaid Services has also established the Hospital Price Transparency Initiative, which helps consumers know the cost of a covered item or service before receiving care. The next organization is the Office of Environmental Justice. Established through the Environmental Protection Agency, this office is aimed at protecting and promoting environmental justice and public health in vulnerable communities through policies, programs, and activities. Their 2022 to 2026 strategic plan included 8 priorities, of which are improving access to federal funding and assistance programs, strengthening the EPA's External Civil Rights Compliance Program, and ensuring public access to EPA programs and activities, as well as full protection from health and environmental harms for persons with disabilities. Next is the Bridge of Life. This is a nonprofit organization that empowers local community health workers and patients through education and training activities in an effort to achieve sustainable changes in healthcare. The Bridge of Life is international in scope and has helped people worldwide. Lastly is Project Cure. This is a nonprofit organization that supplies medical equipment and supplies to hospitals and clinics in need worldwide. Project Cure has a focus on treatment and prevention of infectious diseases such as HIV, Ebola, malaria, tuberculosis, as well as our recent COVID-19 pandemic. They also provide relief after natural disasters. Project Cure provides 3 to 5 semi-truck size oceanic tanks full of medical equipment each week to at-risk countries across the world. At a state level, their COVID-19 efforts included providing 4.5 million pieces of medical equipment and nearly $5 million worth of personal protective equipment within the U.S. This concludes our special segment on health outcomes and disparities within vulnerable populations. Thank you for tuning in. We are signing out.
Thank you, Grace, and thank you for joining us today as we explore the challenges and urgent issues facing vulnerable populations who are not accessing healthcare. From systemic barriers that hinder access to life-saving treatments to the economic toll on families and communities, it's clear that these problems affect us all. But there's hope. Nonprofits like Bridge of Life and Project Cure are actively working to bridge these gaps, providing essential medical resources and training. Governmental agencies like the Centers for Medicare and Medicaid Services and the EPA's Office of Environmental Justice are also stepping in to create lasting change through policy and public health initiatives. Together, these organizations represent a powerful force for equity and health access. We all have a role to play in advocating for a system that serves everyone. Thank you. We'll see you next time on CRNA Today.